My name is Dr. Mkono. We're going to go over nebulizers. I am a pulmonologist. I want to emphasize the importance of following the prescriptions that you are given. This is not medical advice, educational purposes only. This is a nebule. You'll get your medications in here. We're not going to discuss that right now. It all is based on the prescriptions you've been provided. Medication will be administered right in between this centerpiece and the wall. You would squirt it there. It comes disassembled. You're going to have to put it together. And it's very simple. You're going to put this piece here. It won't fit any other way, so that's a good thing. And you twist this back in here together. You can either have a mask or you can have a mouthpiece. This tube, you stick it in here. It's a very long tube. You need a machine, okay? You put that right in here and you have an on-off switch and it connects to the wall. I'm gonna just make sure we have all the liquid in here, and remember, just take nice slow breath in and out until this liquid dissipates. That's how it goes. And that's pretty much it, just until all this dissipates. If you're in a hurry, I would just recommend that if you do the best you can and get rid of most of it, then just don't leave it like this falling. Discard it. Throw it into a little container or in your sink. Keep these dry so that they don't accumulate moisture and grow other things that we don't want in there. And keep it clean. Take care.